Good evening. Good evening. Hello, everybody. It's Dr. Croom, and you are in the right place for our senior pet chat. That's right. Every Monday night, we get together and we discuss all things senior pets because we love senior pets. I really love the chance to work with them to help their pet parents really understand what's going on. I love their little grizzled grays and a little stank attitude sometimes. Senior pets, we love them. And as you may know, you can come and join me every single Monday night for our senior pet chat. So I'm glad that you're here with me tonight. I am broadcasting on not only the Dr. Crew Facebook page, we're also on LinkedIn as well as YouTube. So we're trying to really spread out and get this information about senior pets out there so that everyone can take advantage of that. We don't always get the chance to get on with a live vet to talk about things that are really important to you. And our pets are so important. They're part of the family now. And if you have a senior pet, chances are they've been with your family for a long time. You know, I've met families where the pets have been a part of the family longer than the kids. And you know, if the senior pets are having issues, or even, you know, having to use the last wishes service that we provide, it's just heartbreaking for those youngsters. You know, I mean, it's bad enough for the adult parents, but for the youngsters who that pet has been there their whole life, it's horrible. It can be really horrible. So I am here to help with that process of loving on the senior pets as well as knowing what to do in certain situations. So tonight, our topic is senior pets and cancer. Senior pets and cancer. If you have ever experienced cancer in any of your pets, so we're not just talking about dogs or cats, you know, cancer can crop up in our farm animals, you know, even in fish and reptiles, right? Because cancer, it doesn't discriminate. We always see that it does not discriminate. All cancer is overgrowth of cells. It's an overgrowth of cells. And as a matter of fact, all of our human bodies and all of our pets' bodies already come with a little bit of cancer in there. It's already some in there. And what it takes is some type of a trigger, or sometimes it could be our immune system being low. It could be some disease process that gets in, and it could be a trigger of some sort, like some type of insult to the body. And so we need to know what to do, how to identify cancers as they come up. And that's what we're going to talk about a little bit here tonight. So if you'd like to put something in the chat as far as if you've experienced any type of cancer with your pets, a certain kind, let me know. You know, in dogs and cats, there are certain cancers that tend to be more prevalent. If you're familiar with any of those, please put them in the chat. Again, we do sometimes give prizes for answers in the chat. So if you have any answers to these, or you have had some experience, because our combined experiences is what's going to help each of us as we go through and deal with this kind of situation, which is cancer. So we know that cancer is definitely one of the most common ailments of pets that causes them to pass away. Cancer affects about 10% of dogs. So let's say there's 70 million dogs in the United States. 10% of those will get cancer. And we've got different kinds of cancer. If you're familiar with some of the different kinds of cancer, go ahead and put in the chat. I've got the top 3 types of cancer that are typically found in pets. And I'd like to see if any of you know what those might be, how they might be different from cancers found in humans. So let me look over here and see. I see a comment over here. Hi, Robert, Crazy Air Homes. Great to see you tonight. Thank you for being here. I'm glad you haven't put anything in the chat because that means that maybe you haven't experienced this horrible disease of cancer in any of your pets. I would love if you did not have to experience that. But if you do know of what you think might be the top kinds, then I'm going to go over that here for a minute. One of them is mammary gland cancers. So breast cancer. Oh, you have. Okay, so you have had a cat, Robert, that had cancer. Do you remember what kind by chance? There's so many kinds. And all the cancers that we humans deal with, melanomas, osteosarcoma, like all of those, same thing for the pets, which is why, being a holistic vet, I tend to think that, the holistic measures that we humans can take to decrease our chances, same thing on the pet side. Improving their health through their nutrition is at the very top of the list. And so we've got mammary gland tumors, which is one of the most common kind to find in our pets. We've got lung cancer. That is also like the number 2 most common cancers that are found in pets. And then thirdly, we've got various soft tissue sarcomas. So with those sarcoma, you've heard that name. You've got hemangiosarcomas, which involve blood, fibrosarcomas, which is the fibrous tissues, neurofibrosarcomas, and osteosarcomas. So we hear sarcoma, that's those soft tissue cancers that can be found and can be very, very deadly. Okay, Robert, you said your cat wound up with a stomach cancer. I'm really sorry to hear that. That can be so tough. So I've got a lot of clients who come in, they know that I specialize in senior pets. And so some of the things they want to know is like, what do I need to be looking out for? Like, what are some of the signs that I could know that my pet might have of cancer? One of those things is feeling around for lumps and bumps, unusual lumps and bumps on your fur baby. That could be in a horse, it could be in a cat. You got to be observant of your pet on a daily basis. You are the main one. You're the only one who's going to know, you and the family, differences that are happening, day to day and week to week. Taking a one glance at an animal, that's just a snapshot. And so we are going to rely on you for that history to find out really what's been going on. And lumps and bumps, feeling for them as you're petting them, playing with them, and all of that stuff. You want to make sure that you're noting these things. And if you do feel a lump or bump somewhere, make a note of it. And then 2 weeks later, is it the same size? It's kind of funny how with masses and tumors that we find, for some reason, I was just telling Vet Tech Tony this the other week. It's like, why are we always using these food-related items? We feel a mass, and it's like, okay, it's an apricot-sized mass over here, and over here, this lymph node kind of feels like a grape. Like, what is the deal? I don't know. It's just a thing, but it's just very easy. It's probably just because fruits are things that commonly different people are going to know, and it's just like a general, like a standard size thing. So that's probably why. But I think it's kind of funny that it's always a food, so lumps and bumps. Now, a lot of times, certain breeds, especially with dogs, they are more prone to just generally having lumps and bumps. Anybody know what breeds those might be? We call them our lumpy bumpy babies, and certain breeds like Labradors. We've got certain breeds. Oh, you mentioned Dobermans. Yes, definitely a lumpy bumpy. Golden Retrievers, Labradors, definitely. Just it seems like all the friendly ones, the ones that are so friendly, even though Doberman, that doesn't necessarily quote unquote fit into that. But just the big dogs that you just expect to be family dogs licking your face, just, letting people in the house, letting, robbers right in the house, licking them. Those breeds that are just so friendly, they always tend to have those lumps and bumps, a lump over here, a soft, swelling over here. Oh no, there's another mass that has formed down here. And so pet owners, of course, are going to be nervous about that. So you got to keep your eye on that. Masses, feel for any warmth, if there's pain associated with them, and if they are growing, you got to keep your eye on that so you can get in touch with your vet. Okay. We've also got any sores or open wounds that are not healing. It's like, okay, all of a sudden they just got this wound. It's like, okay, well, cut himself or something like that. We're cleaning it up and everything like that, and it just is not healing. That could be a sign that cancer may be in the perimeter. Weight loss, appetite loss. Those are things that, because when you think about this cancer, which is again an over proliferation of cells, just keep growing and growing, they need food. They need food. They need energy to continue that. And so they're taking, just like a tapeworm would just take all the nutrients that the animal is actually taking in. Same thing with the cancer. It just sucks up all the nutrients. And then your animal's body tends to be losing weight, muscle mass has been lost, muscles atrophying, starting to see backbone and different bones and things like that. It can be really tough to see, really sad to see. A couple other things you could look for pets with cancer would be discharge from various body orifices. Really any orifice. We typically would think, the mouth and the nose, any type of discharge, excess blood, anything coming from, the anus, front, back, any orifice in the body. Just some discharge and stuff coming out, that means there's something inside it is oozing out and it needs to be looked at. And then finally, or actually we've got a couple more things. One is an odor. You may notice a certain odor all of a sudden. You're like, okay, like, fluffy is little, and it's not the normal, just bad breath of the teeth or something like that. It's like something else there. And a lot of times when pets have a cancer of the mouth, nose, or anus, there's a really, really bad smell that starts to proliferate. So you want to be aware of that. Couple other things, mobility issues. Now this can really throw people off because they're thinking arthritis. Oh, we're just older, get a little older, little cartilage in the knees. That lack of mobility could be from arthritis, yes, but it also could be from nerve, muscle, or bone cancer. Okay, so you want to make sure that we're very careful. You get that pet checked out. Don't just assume that it's the more benign situation. Let your veterinary professional help you out with that. Okay. And a couple other things, respiratory issues, maybe some wheezing. All of a sudden they're doing some stuff at night or something weird going on there, or straining to use the bathroom. Either way, front, back, number one, number two, any of that, straining issues, all of these things you need to check out because they could be signs of cancer in your senior pet. Okay, let's see. Hi, Kayla. How you doing? Great to see you. Great to know what's okay. All right. Okay. Maya wants to say hi, Kayla. Hey, say hi. She's so excited. She's excited because whenever I come on to go live, I'm all boisterous and loud, I guess. And so she immediately goes and gets the toy. And it's like, okay, so it's time to play, right? So but we're talking about a serious topic here tonight. It's one that you would never want or hope for your own furry friend or anyone else's. So some of the ways that you could diagnose those things, though, that your vet could do would be, you could do a needle aspirate. If there's a mass or a lump somewhere, get that needle, pull out the fluid, and see what the lab test says as far as what kind of cells are in there, what kind of exudate is in there. You could also do an ultrasound or CT scan, something like that, so you can visualize and see if there are any masses throughout the body. Okay, so those are the ways that you can do some diagnostics. Now, treatment-wise, again, very similar to humans in that you've got really like the main three options that we've had for just decades and decades, right? If you've got cancer, if you've got a mass somewhere, you can surgically excise it, right? And you could do chemotherapy, and then there's also radiation. Okay. A lot of times with the surgery, with the way cancer is and the way it grows, it can project fingers out, or it could obviously move to lymph nodes and move throughout the system. That's why you want to catch it as quickly as you can. And so surgery, you may still need the chemotherapy and or the radiation. So all those things together, I think, would probably be considered, the gold standard of veterinary care for a mass that can be removed. All masses can't be removed necessarily, depending on where they're located. And so surgery, radiation, chemotherapy, you may need to use one or all of those situations. Now, we do know that there are a few newer modalities out there, that have come out in these past couple of decades. We've got some more immunotherapy. Now, immunotherapy has to do with, just like it sounds, a person or an animal's immune system and doing things to really boost that up so that they can knock things like cancer right out of there. Okay. So immunotherapy, another way that it is better than the chemotherapy and radiation. Sometimes, there's pros and cons to everything. So we can't just say, oh, okay, now we've got immunotherapy and radiation and chemotherapy aren't useful. They can be very useful. And there could be some cons to this immunotherapy as well. But one of the pros of the immunotherapy is that you can more easily target a specific cell type and not do an overall just kind of blasting of the area like chemotherapy does. We know that very well by now that when chemotherapy and radiation are done, that other body cells are killed in the process too sometimes. And our immune system just really takes a huge hit from those things. So if you are dealing with cancer in your senior pet, make sure you ask your vet about immunotherapy, whether it be them doing it, whether it be a referral. But there are some newer methods out there, so don't fear. Now, most of the studies that have been done with the immunotherapy, though, has been done on humans. There hasn't been tons and tons on animals yet, so we're still working on that. Heck, maybe I'll do a study in 2023 and looking at this, because as a holistic veterinarian, this really hits hard, especially when, people come to me specifically for trying to eliminate some of the more harsh things for their pet's body, whether it be vaccinations or whether it be, chemotherapy or radiation. They want to know, is there something else that I can do that could still be beneficial, but might not wreak so much havoc on my pet's body? And that's where I come in. Okay. So I am an integrative vet, though. So if a pharmaceutical is needed, or if that's going to be your best bet, you can best believe I will tell you that. But I will also let you know of some of the holistic modalities that you might want to look at. Sometimes we can hit a cancer with some of the more kind of harsh ones first, and then taper off and kind of titrate off into something a little bit less harsh. One of those things that I actually am very, very happy to be able to offer to my clients has to do with the realm of mushrooms. Anybody out there a mushroom fan like me? I love mushrooms. I love them in practically everything. Put them in the salad, a fresh salad, uncooked, raw. You can put it in the skillet and, like make a little, I love mushrooms. You too, Robert? I knew it. So with the mushrooms, I don't know. Have you seen that one movie? What was it called? It was something like The Amazing World of the Fungus. And it was so amazing just to see that network, that mycelial network, of how they communicate and how they support the huge trees and how amazing mushrooms are. And so with cancer, we've found that certain types of mushrooms can be very helpful. So one that I have for my clients is the turkey tail mushroom. Are you familiar with that? Turkey tail mushroom specifically is one of the top mushrooms that you'll hear about when you're doing any type of research on pet cancer, probably humans as well, because the turkey tail mushrooms, they boost the immune system. They can help slow the rate of growth of the cancer cells. It can reduce the harsh effects of the radiation and chemotherapy. So again, we can use some of these simultaneously, and kind of like balance out some of the things. Sometimes we need some of those harsh ones, and then we can come in with these mushrooms and smooth it out a little bit. We've also got the turkey tail mushrooms as being a very, very potent antioxidant, as well as rich in calcium and minerals. So you don't have to have cancer or have any diagnosis to take turkey tail mushrooms or other kind of mushrooms. I also got a shaga mushroom, and these are both right on my website if you are interested in those for your pets, whether they have some type of a tumor or mass or not. Really, really good for the system. You already know the website, drcroom.com. And I'm looking to see if there's any more notes. Okay, Robert, you do use mushrooms to treat yourself. Excellent. That is what I'm talking about. If you haven't found out about mushrooms to, be taking internally, we're not talking about psychedelics, people, okay? We're talking about mushrooms that are really great for your immune system, okay? So if you're interested, go to drcroom.com, check out the mushrooms that I have available for our pets. And, if you are just checking in with this video now, we've been talking tonight about pets and cancer, senior pets and cancer. We know it's not only senior pets, unfortunately. Sometimes tumors and neoplasia will come into younger pets as well. It can be hereditary. It could be, again, something that comes in, some type of insult, sometimes even just from the outside of the body, and create a wound of some sort, and then it's just a trigger because those cells that, again, the cancer is already in our bodies and it just needs a trigger sometime, or our immune system to be low. So everybody out there, get your immune systems as well as your pet's immune systems up to speed. I don't want you to have to be calling me for any of that stuff, but if you do need me for your pet, you can always come to drcroom.com. Also, every Monday I'm going to be here so that I can help you out with some of the ups and downs and questions you might have about having a senior pet. We love senior pets around here. So hopefully we'll see you again next week. Whatever link, whatever platform that you are watching this in, check out the link there. We have a future veterinarian campaign that we are raising funds for so that we can connect students who are interested in veterinary medicine with licensed veterinarians virtually. So we could have a horse veterinarian out in Wyoming connecting with a college student here in Kalamazoo, Michigan, make that connection and help that student figure out which way they want to go. It's right in the post. I would love your support. Thank you very much, and we will see you next Monday on Senior Pet Chat.